Hey you guys, it's April again, one of your guys' classmates. So today's topic that I picked for discussion number 5 for this class is patient choice. I picked patient choice for many reasons. Recent studies have examined the rising demand of patients to choose their medical providers. In such studies, researchers have come to an agreement that the choice medical provider is determined by some factors. They therefore claim that this practice can be associated with some positive and negative consequences to the patient. Nonetheless, it is important to mention that among the major factors that contribute in the increased cases of patients' choice of the physicians is the increased use of internet to access data and information on medical care and services. Besides increased exposure of the patient's own experiences, reviews has played a role in encouraging the patients to opt who will offer them medical care services. Therefore, this aims to examine the reason that determines patient choice of medical care providers in an attempt to uncover the pros and cons associated with this practice. I have been on both sides as a patient or a family member to a patient, or as a healthcare provider and dealt with patients and their families. I feel like this is a very important topic, generally all over. Patient choice of medical providers is believed to be determined by the interaction between the features of the medical provider and the patient. In the real sense, most of the patients who opt to decide who do offer the medical services seek to obtain high quality at reduced costs. However, it is important to mention that most patients lack information regarding the choice of medical care providers. Thus, most of them cannot and do not make a rational choice of their medical providers. I feel like this is just a generalized, it's happening a lot. And I feel like sometimes as healthcare providers, we fail our patients by fully informing them. But again, it doesn't just go back to the healthcare provider. Overall, our health system is going down. And I feel like, if you do not have the background in medical, you do not, when you go to get services or to seek treatment, a lot of places give you the bare minimum treatment. I feel like this isn't fair, and that patients, yes, they do have rights, but I feel like, their options are not being shown to them. No one's talking to them on a level where they understand, and goes over things with them. I feel like sometimes overall it's, maybe the physician that kind of guides them into what they need to do or makes a choice for them, because some people don't know their choices and they put their trust in us and they go with what we say. And I feel like, again, this is a very important topic. So kind of looking forward to talking more about this topic later on in our final discussion. Thanks for watching my video. Have a nice night.